ACT Accelerator principals, meeting observers, and colleagues. My name is Bruce Aylward. I'm a special advisor to the Director General of the World Health Organization, and I head the ACT Accelerator Hub. Before we get started, I'd like to remind everyone that we have simultaneous translation, thanks to our translators here in the back of our room here in Geneva, who will be translating into all 6 of the UN languages. And I believe you can find the translation icon on the lower parts of your screens to be able to access that. I'd also like to remind participants that this session will be live streamed, and the link to the live streaming has already been shared with yourselves and others. And with these formalities out of the way, I'd like to, it's my pleasure rather, to hand over the meeting to our host, Dr. Tedros, the Director General of the World Health Organization, to give his opening remarks. Dr. Tedros.
Thank you, Bruce. Your Excellency, Dr. Zweli Mkhize, my friend, Minister of Health of South Africa, Your Excellency Dag Ulstein, Minister of International Development of Norway, Mr. Pierre of the European Commission, Department of Health and Food Safety, Excellencies, ACT Accelerator principals, dear colleagues and friends. Thank you all for your continued partnership, and thank you for joining us today. I would like to start by welcoming the United States of America to the ACT Accelerator. We're glad to have your support and involvement, and we look forward to your partnership in ensuring that all countries enjoy equitable access to vaccines, diagnostics, and therapeutics against COVID-19. We are at a critical juncture in our fight against the pandemic. Through a monumental global effort, we now have an array of vaccines, diagnostics, and therapeutics that can help us bring this virus under control. But we face significant challenges. International collaboration is increasingly fragmented, and inequities are increasing, as we all know. More than 90% of countries now rolling out vaccines are wealthy. 75% of the 130 million deployed doses have been in only 10 countries. Meanwhile, almost 130 countries with 2.5 billion people have yet to administer a single dose. Many of these countries are also struggling to secure the resources for testing, personal protective equipment, oxygen, and medicines. The ACT Accelerator and Covax facility were created to increase equity. But with every passing day, that goal is at risk. Countries are ready to go. COVAX is ready to go. But adequate supplies of vaccines aren't there early enough. The longer the COVID-19 virus circulates, the more it can mutate, potentially making current tests, treatments, and vaccines less effective. We have already seen several variants emerge that appear to be significantly more transmissible. And as long as the pandemic drags on, so will the economic impacts. Until we end the pandemic everywhere, we will not end it anywhere. This is not an empty slogan. It's a hard reality. WHO and our partners in the ACT Accelerator have laid the groundwork. We have created a dose-sharing mechanism, set up rapid processes for the emergency use listing, set up indemnification and no-fault compensation mechanisms, and completed readiness assessments in almost all AMC countries. But I see three major threats to the success of the ACT Accelerator and COVAX, which need our urgent attention. First, we must ensure the full financing of the ACT Accelerator and Covax. We're grateful for the generous contributions to date, but we still have a long way to go. The financing gap for the ACT Accelerator stands at more than $27 billion for 2021. The longer this gap goes unmet, the harder it becomes to understand why, given this is a tiny fraction of the trillions of dollars that have been mobilized for stimulus packages in G20 countries. We call on all OECD and DSC countries to commit a proportion of stimulus financing to close the funding gap and to take measures to unlock capital in multilateral development banks. Second, we call on all countries to respect Covax contracts and not compete with them. Some countries continue to sign bilateral deals while other countries have nothing. We have issued a challenge to ensure that vaccination of health workers is underway in all countries within the first 100 days of the year. We have 60 days left. We call on countries to support the global rollout of vaccines with dose sharing and donations of vaccines rather than to vaccinate low-risk groups at home. We have made the moral argument. We have made the economic argument. No emerging evidence that variants could make vaccines less effective is showing that unless we suppress this virus everywhere, we could end up back at square one. And third, we need an urgent scale-up in manufacturing to increase the volume of vaccines. That means innovative partnerships, including tech transfer, licensing, and other mechanisms to address production bottlenecks. Your work as the Facilitation Council is vital. The success of this effort ultimately comes down to political decisions. I would like to express my deep appreciation for the tireless work of our two co-chairs. Minister Ulstein, you have the floor. I thank you.
Thank you so much. Good morning, good afternoon, and good evening to you all. Thank you for joining our fourth Access to COVID-19 Tools Accelerator Facilitation Council. And again, a special thanks to Dr. Tedros and the European Commission for co-hosting today's meeting. A meeting that is live streamed so that members of the public can follow the discussions. Transparency, openness, and cooperation are key factors to continue and to strengthen the trust that is needed, especially when it comes to the last mile. This cannot be a top-down driven mission. We need to engage community leaders. We need to work with civil society organizations who are the ears, the eyes, and the willing hands out there in the field. More than 2.3 million people have now lost their lives. Only in the past month, more cases were reported than during the first 6 months of the pandemic. New and more contagious variants of the virus spread to additional countries. In fact, we may have to live with this pandemic indefinitely unless we take real action. And global cooperation is simply our only choice. We all do realize the self-defeating nature of vaccine nationalism, yet we somehow fail to act on this insight. Vaccine nationalism only helps the virus. It only helps the virus. And no forum is better equipped to start turning this trend than this one. The next few months are crucial. The next few weeks and days are crucial. We have to keep telling each other Convince finance ministers and business leaders and taxpayers of the world that no matter how much we pay to stop this, it will amount to nothing compared to the cost of not stopping it. Cost meaning loss of lives, loss of jobs, loss of life-saving educational opportunities, loss of businesses, loss of tax revenue. As Dr. Tedros himself has put it, the world is on the brink of a catastrophic moral failure, and the price of this failure will be paid with lives and livelihoods in the world's poorest countries. We cannot leave anyone behind. People who will not be covered by the global allocation of vaccines and who depend on a humanitarian buffer must also have the same right to be protected against the virus. This is the kind of meeting where I think that really all of us actually could summarize before the discussion starts. World leaders, leaders of today, we face a moment of truth. For a time like this, we could invest in the cause of this human and economic crisis, or continue to spend trillions on the consequences with no end in sight. Cooperation has made the world a more prosperous place over the last decades. Now we need it more than ever. If we fail, we will not only fail today. This is not only about this crisis, it will undermine the incentives for cooperation through global solutions in future crises, and we cannot let that happen. The virus will continue to circulate months, perhaps years, and with the mutations we see now, there will definitely be more of that. And ultimately, there's a huge threat for all of us. It could even make the vaccines even more and less effective. There is so much at risk. Multiple research studies conclude with compelling reasons to invest in the ACT Accelerator. And together with South Africa, Norway held a meeting of finance ministers who expressed that strengthening health systems, cooperation on development, supply, and distribution of tests, medical treatments, and vaccine is pivotal. With our revised strategy and budget, which you will hear about today, we have addressed the requests of donors. And Norway has led a working group of council members and economic experts to explore all possible potential financing sources. So, dear colleagues, the case for global collaboration could not be stronger. And it's now my great pleasure to hand over to my co-chair and dear friend, Minister Mkhize, the Minister of Health of South Africa.
Thank you very much, Minister Ulstein. The Director General of the WHO, Dr. Tedros, and we thank the WHO together with the European Union for hosting this webinar. Welcome to all excellencies, distinguished ministers, dear colleagues and friends. At our last meeting, just 8 weeks ago, we had a sense of optimism that science had prevailed. Vaccines were available to the world in record time, and extraordinary accomplishment. The light at the end of the tunnel I talked about is still there, but unfortunately dimmer than we had hoped. Today's worries about numbers infected and dying are accompanied by concerns of the emergence of variants globally. In my own country, we are facing a particularly cruel variant that has escalated cases and sent an even greater wave of fear to our communities. The impact of this is having on lives and livelihoods is terrifying. On the continent of Africa, there have been 65,000 deaths and more than 2.6 million cases in the WHO Afro region, with a case fatality of 2.5. In fact, the total case numbers for the African continent stands at 3.6 million, with 94,000 deaths. The continent is facing a second wave, which is centered largely on the southern sub-regions. Still, we must remember that the transmission varies so much from place to place, and therefore a second wave is not experienced uniformly throughout the whole continent. On 42 of the 47 of WHO African region countries that are now experiencing community transmission. There's also been a bit of some good news that over the last 3 weeks, the number of new cases has started to decline across the region. It is yet too early to determine if this is a decline that will be sustained in the coming weeks, or a third wave or resurgence will be experienced in some of the countries. So there's been a lot of fatigue amongst our health workers and amongst our communities. And this is important because despite all of that, we have to actually continue with the work of suppressing the transmission, which has gone on the past 11 months. This variant, coronavirus 501YV2, which has been first identified in South Africa, has now also been identified in other countries. It has spread rapidly to become dominant strain of the virus in our country. Data have indicated that it's also able to avoid antibody response, with a possibility of making vaccines previously developed on the wild less effective against this variant. Thus, calling for all of us to take account of this and scientists to continue with their investigations to ensure effective vaccine. Additionally, the fears we had about global inequity are being realized. Well over 100 million doses of vaccines have been administered, and around 75% of those are in 10 countries. This is what the Director General has pointed out. Alarming and disappointing numbers, which we need to change in the way that things are happening. It has to be different to what we're seeing now. But we can only do that if we work together. And it's all about political choices that we make, and no one country alone can do this. COVID-19 doesn't respect national boundaries. We have a shared problem with the potential to share a solution. Covax brought us promising news last week that vaccines will reach low-income countries within a matter of weeks. It is important to see that this multilateral model that we have all are contributed to and supporting it, that it actually works. We also need to stand behind Covax and see all actors have a role to play. Covax and X Accelerator, which is part of, needs significant funding to continue its mission. We've also great news from the team working to find new and cheaper diagnostic sets, with new diagnostics soon to be available at 50% of the cost of the current rapid tests. Vaccines alone will not relieve us from the pandemic. We have to invest in the entire package of treatment, tests, health systems, plus vaccines. Our meeting today, therefore, will reflect on the progress and show us in greater detail what fully funding X Accelerator will do and how we can secure that. Since our last meeting, the United Nations Secretary General called on the global community to fully fund the access to COVID Tools Accelerator, saying that the world's leading economies have a special responsibility, that science is succeeding, but solidarity is failing. Dear colleagues, let's heed these words and work together to ensure that the fruits of science are for all, not for the few. Now, before we move into the substantive part of our agenda, I'd like to invite Mr. Pierre, the Deputy Director for Health and Food Safety Commission of the European Commission, to make the opening remarks. Mr. Delso, please, you're on the floor.
Thank you very much. Thank you very much, dear Director General Tedros. Thank you very much, Minister. I hope you can hear me, because it was technically difficult to join you. Okay, thank you very much for this. First of all, I would like also to welcome the presence of a US representative to this meeting, because I believe it's a really good indication of the fact that the work that you are doing is really a global one and concerns everybody in the world. So I believe that's something which is extremely important, because it's only by working together that we can cope the challenges which are in front of us. As you know, in Europe, things have changed since our last meeting on 14th of December, because we have now authorized 3 vaccines, and we have started the vaccination of thousands and thousands of people in Europe. Let's not forget that some of the European member states are still among the highest infection and death rate per inhabitant. So vaccination is needed in those countries like any other place in the world. So the objective is to get a vaccination by the summer of 70% of the adult population. And by that, we hope to reduce the number of dead people and also of hospitalization rates. So we believe this is a very important element for all of us. Now, I would like to insist on something which is not necessarily so well known. We, as a European Union, we have increased the production of vaccines in Europe by putting a lot of money in the production facilities. But these productions of vaccines, it's not only for the European Union. Those vaccines which are produced in Europe have been and are being sold to the rest or distributed to the rest of the world. And so millions of vaccines manufactured in the EU are actually have been exported to all continents. And I believe this is a very important feature. Now, if I look at the work you have done, I would say that the news on Covax are really bringing you hopes. In a few days, we will see the first vaccines purchased through Covax being delivered to 18 countries, to be followed in March with more quantity in 145 countries. The primary objective of Covax, of equitable access to vaccines, is becoming a reality. And here, I would like really to thank the great work which has been done by WHO and by Gavi, and also by some of your colleagues, which makes this a reality. And as it has been explained by the South African minister, we need to get vaccination everywhere in the world, because a safe world implies that everybody gets access to this. Now, even if we have successes, and this is Covax is certainly one, and a very important one, we should look at the question of the variants. As this has been explained by the South African minister, variants are already existing in some part of the world, but we might have new types of variants appearing in the future. So this issue of the variants and how to cope with the variants is a very important one. So we need to work together. And one aspect which certainly is important in this context is the sequencing capacity and the test. We need to do more and more if we really want to cope with this issue. Ladies and gentlemen, this year I hope will be the year bringing pandemic under control. The successful rollout of Covax, the expanding vaccine production capacity, and the developing and delivering of new diagnoses for tests and sequencing are some of the challenges of the months ahead. But together with ACTA Accelerator, we will make it, all of us, everywhere. Thank you very much.
Thank you very much, Mr. Delso. We'd like to welcome the new members who are joining the Facilitation Council as the new chairs of the regional cooperation groups, and to thank the former chairs for their contribution. For Association of Southeast Asian Nation, ASEAN, we'd like to welcome Brunei Darussalam, and would like to acknowledge the contributions from Vietnam. For Pacific Island Forum, PIF, we'd like to welcome Fiji, and would like to acknowledge the contributions of Tuvalu. For the African Union, AU, would like to welcome the Democratic Republic of the Congo. For the Commonwealth of Independent States, we would like to welcome Belarus and thank Uzbekistan for their contributions. We'd also like to welcome Peter Witty, Executive Director, Water Youth Development Projects, who will be replacing Caroline Gomez as one of the two representatives of the communities of civil society organizations. Welcome, Peter, and thank you, Caroline, for your active participation. Distinguished delegates, with these formalities now completed, let's now move on to the main aspect of the agenda. The focus of our first agenda item is the refreshed ACT Accelerator prioritized strategy and budget. At our last council meeting in the late December, we asked the ACT Accelerator to refine and prioritize its work for 2021 in the light of the evolving context we're operating in. The ACT Accelerator hub and pillars have worked at light speed to produce the consultation version of the new strategy and budget that was shared with you all last week. To start, Sir Andrew Witty, WHO Envoy Emeritus for ACT Accelerator, will provide us with an overview of how ACT Accelerator is changing in a rapidly changing world and share with us the prioritized strategy and budget for 2021. Then we'll open the floor for the Council's reflection on a dialogue with the ACT Accelerator principals who are here with us and can respond to the Council's question. So at this point, Sir Andrew, you have the floor. Thank you very much.
Thank you, Minister Mkhize. Very much appreciate your kind introduction. Co-chairs, Excellencies, Dr. Tedros, my fellow Special Envoy, Dr. Ngozi, and ACT principals, it's a great pleasure to have the opportunity to update you all on the progress of the ACT Accelerator work. I simply have the very simple role of being the messenger of enormous amounts of dedicated effort from all of the participating organizations within the ACT Accelerator, and also supported by the extraordinary commitment of the South African and Norwegian governmental teams who have played such an important supporting role and leadership role over the last few months. I'd like to really address my comments to two key audiences. One is really the national leaders and finance ministers, and ask them to reflect on the value for money proposition of investing in bringing this pandemic under control in 2021, and to shorten the continued stimulus requirements that would be required if we fail to bring this pandemic under control. The second audience I'd like to talk to directly are the leaders in the private sector of companies who control significant manufacturing capacities, which, in my view, should now be looking to bring together increased coalition building to allow us to accelerate the expansion of key capacities in some of the technology areas which have been developed during 2020. So if we could go to the first slide, please. This, I think, will be familiar to everybody. We're well aware of the very grim history of this pandemic and the way in which we've seen the second surge of infection and deaths across the world. The most important point about this slide is that no part of the world has avoided the risk. And it's also relevant to remember that so many of the world's population have not so far been infected. And therefore, the potential for this virus to continue to be dangerous remains high. And the inevitable development of variants and mutants, which we've seen, of course, increases that possibility. So this is not over. It remains a present threat, and it's one which we cannot and must not underestimate. Next slide, please. So the ACT Accelerator during 2020 achieved a huge amount. Most importantly, it brought together all of the relevant delivery agencies, research agencies, many governments, civil society, to work really with a single-minded mission to address ways in which we could identify, prevent, and treat disease. We saw extraordinary stimulation of discovery efforts. Of course, those efforts were not simply being managed by ACT-A. The United States, which I'm delighted to welcome today, played a key role in underpinning much of the discovery work, as did the European Union, as did other national governments. But the ACT-A organization has found a way to really create a broad tent which allows all of these technologies to be brought together and to think through a rational pathway of how different countries at varying income levels can create a defense mechanism and an ability to manage and prevent COVID-19. You saw during 2021 significant development work around vaccines, diagnostics, and of course treatments. And you can see on this slide just some of the early evidence of the scale of the potential delivery globally, but of course with a strong focus on equity into the low middle income countries in particular. Next slide. I should say this particular set of deliveries could not have happened without dealing with some of the more tricky policy dimensions of distribution equity. And I'm very pleased, having been a veteran of swine flu, bird flu, and the Ebola responses, many of the key policy issues which were unresolved during those crises have been resolved in this crisis. That's important because it means that we can focus on delivery and impact. Next slide. I also want to acknowledge the very substantial support of many governments and individuals and foundations financially to allow the work to get done during 2020. $6 billion raised, and very positively ongoing confirmation and discussions with the United States for further support. And I know that many other national governments are considering how they can further support the development of the ACT-A agenda. Next slide. So as we turn into 2021, things have moved on. we clearly have now the great news of the availability of vaccines. And we're seeing in the countries who have been fortunate enough to begin mass vaccination, how that has raised the spirits of the populations, has increased confidence of those governments and their people, and clearly beginning to show the early signs of having an effect on the pandemic itself. The great challenge is it can't be restricted to 10 countries. And what we really see is above and beyond the equity requirement, biology tells us also that we have to make sure this is a global multilateral rollout. Viral variants are now also a reality. So as humans have been able to step ahead with vaccines, the virus has matched us with its variants. Those variants can emerge from anywhere, and they will continue to emerge for as long as this virus circulates in large populations. And so it's crucial that as we think through the strategy for 2021, we remind ourselves of the need to move forward as a single global community, and not with the idea that small populations can somehow be safe on high ground and leave everybody else behind. International collaboration, as you've heard, is already having been strong, has become more strained as pressures, inevitably pressures between domestic and multilateral agendas become a reality. But the biological, the human equity, and the financial logic is overwhelming that a strong, global, integrated response is the right way to deal with scaling up the tools we have to deal with this pandemic. Next slide. So, as you heard, we've recently, or the teams have recently worked together to refresh the strategy and the financing requirements for the ACT Accelerator. That set of documentation is available to you all and was issued as a draft on the 3rd of February, and I hope you've all had a chance to have a look at that. I really want to acknowledge the tremendous work of the WHO Hub, led by Bruce, the role of our co-chairs, and of course the role of our ACT-A principals and all of the member organizations to pull this together. This really is an excellent assessment of threat, the potential tools that we have, and the need, financial need for how to address this. I think the utility of further challenging the strategy and the financial justification is minimal. And the focus should really now be on adopting an aligned path forward. Next slide. So for 2021, ACT-A really has 4 core priorities. All of these will resonate to what you've heard from our political leadership in the first part of this meeting. First of all, we need to rapidly ramp up the volume of doses available for vaccination, and particularly through the Covax facility, through which we have what is probably the world's largest ever multilateral coalition focused on helping all countries to move forward through this pandemic. To do this, we require financing support, and we require the support of manufacturers to increase manufacturing scale. Last year, the manufacturers came together in extraordinary coalitions to resolve discovery challenges, to blend technologies and to work together to get through the discovery phase. And many of them have worked together to expand their manufacturing supply chains. I would issue another challenge. This is another year to ask our private sector colleagues to work together with their public sector partners to create fundamentally larger scaled capacities so that we can truly bring the whole world forward through the pandemic during 2021. We need also to continue to bolster R&D. I think there was a period toward the end of 2020 when perhaps we thought that light at the end of the tunnel was a bit closer than we all thought. The variants tell us it's not, and we shouldn't take anything for granted. So continued R&D capacity, ability to really work through quick evolution of our tools, make sure we stay one step ahead of the variants, make sure we have a radar capability to see new issues surfacing, become absolutely crucial. Alongside that, making sure that we have our eyes open, that we're driving appropriate testing, and we're ready with our supportive therapeutics and PPE in all countries of all income levels. And then, of course, to ensure that the supply lines are open so that the physicians, nurses, and clinicians are properly supplied. So the ACT-A organization in its 4 pillars is focused on delivering these core impacts for the countries across the world. I'd like you to think not about funding an initiative. I'd like you to not think about funding a program. I'd like you to think about funding each other. This is a coalition of all of us. ACT-A happens to be the way in which this coalition has come together to create an efficient, scientifically led, compassionate and equitable approach to resolving this pandemic. The request is that we all pool our resources to help us all. My suspicion is those who give the most probably benefit the most. And this is an opportunity for us all to demonstrate that. Next slide. We've refreshed the budget. There is a remaining need of $27 billion for 2021 to deliver what I've just described to you. But I remind you that if we do this, we would have delivered another 2 billion doses of vaccine to countries that otherwise might be left behind. We would have kept ourselves ahead of the variant risk that this virus can impact. We can ensure that we don't pretend virus doesn't exist when it does by making sure that testing is available. And we can ensure that countries who desperately need the help to build their supply chains of PPE, testing and therapeutics have that support. And we will have done that in an efficient way, in a rational way, where we focus on the things that make the biggest difference and make sure that they have availability when they're required. And of course, that 27 billion is a tiny fraction of what we're spending on the symptoms of this disease. And as any good doctor will tell you, if you know what the cause of a disease is, much better to treat that than to ignore the cause and simply treat the symptoms. And that's what we should really face here today. Next slide. We were asked by many of the donors, quite rightly, to try and segment, if you will, where does all of that money go, particularly in the context of overseas development aid. 27 billion is an enormous number. It's obvious that the response to the pandemic is not an overseas development aid issue. This is a global health and financing issue. In that context, the number is much lower, but nonetheless, it's a huge number. What we've done and what the team have done is essentially package each of the initiatives in a really precise way so you can see exactly where that money goes, what it buys, and what impact it delivers. I don't expect anybody to pass the eye test, which is on the screen right now. This is simply a representation of a distribution of that money between the 4 pillars of vaccine, diagnostic, therapeutics. It shows by color code, the dots show which agency leads so that you know that you've got trusted partners like CEPI, like Gavi, WHO, UNICEF, Global Fund, UNITAID, Welcome, FIND. These are all key, trusted, established partners who are leading on each one of these initiatives. And you can see by the size of the box how much money or what fraction of the budget is there. All of this is in more detail in the documentation, but I really commend particularly our co-chair from Norway, the leadership that they showed in driving this logic. Next slide, please. So as I come to an end, and it's been the most enormous personal privilege to have a small role in helping to support the ACT-A initiative over the last year, I'd like to really conclude with these comments. First of all, we remain in the midst of what I would describe as an unstable crisis. This is unpredictable, we're not out of it, and it could turn on us at any moment. And the more complacent we are, the more unstable it will become. My strong belief, I think supported by all of the members of the ACT-A coalition, is that we absolutely need a global solution. If we are going to come through this in 2020, or if we are going to begin to bring this under control in 2021, we must act together. And the biology and the financial and equity arguments all take you to the same conclusion. The ACT Accelerator now has the tools and the platforms to deliver. It's been helped enormously by the efforts of major countries like the European Union, like the United States, like Britain, many others in the way in which they have developed technologies. We can build on those foundations and bring home to many peoples across the world confidence and security this year if we work together in a scaled multilateral response, which in my view requires governments, finance ministries, and private sector to build on those early coalition commitments and deliveries of 2020 into something much greater this year, a scaled coalition to deliver the impact that the people of the world need in 2021. Minister Mkhize, thank you so much for your time, and fellow delegates, thank you for your attention.
Thank you very much, Sir Andrew, for this great overview. For us to be effective political advocates for the work and financing of the ACT Accelerator, it's crucial that we can understand, support, and articulate the ACT Accelerator's direction and priorities. We have the opportunity now to express our views to the principals of the ACT Accelerator on the new strategy and budget who are here with us today, and to ask any questions we have on the ACT Accelerator's plans for diagnostics, vaccines, therapeutics, and strengthening of health systems to deliver them. I'd like now to ask our moderator, the Senior WHO Protocol Officer, Jude Osei, to help us moderate this session. Jude, please take over.
Thank you very much, Honorable Minister Mkhize. I should like to inform the Council that we've received prior requests from 3 countries to make an intervention under this agenda item. We will proceed to give them the floor first, and then we would ask that those that wish to ask or make an intervention use the raise hands function, and I can already see 2 countries that have done so. We will encourage others to do so if they wish to make an intervention. Again, I'd just like to reiterate that there will be an opportunity for interventions in the next segments on the topics of vaccine equity and the Act A financing. We would restrict our intervention in this session to the strategy and budget that has already been presented. May I also encourage participants to take the opportunity to ask our Act A principals any questions that they wish to know about the pillar priorities and budget. With that said, I have the honor to invite Ms. Veronika von Messlin, Director General for Life Sciences, German Federal Ministry of Education and Research, to take the floor. You have the floor, ma'am.
Thank you very much. I would like to take this opportunity to acknowledge the great work that has been done in driving the ACT Accelerator forward and bringing us together to achieve our common goals of combating the pandemic and ensuring global access to vaccination. We all agree that multilateral cooperation is key to the global fight against this pandemic. This is why Germany has been supporting the ACT Accelerator and the Covax facility in particular since the very beginning, together with our European partners in the approach. To date, Germany is the 3rd largest donor with 600 million in funding for the ACT Accelerator to WHO, ZEPI, Gavi, the Global Fund, and FIND. But now we have to look ahead, as it has been mentioned before today several times, and we have to secure the prospects of success for the ACT Accelerator. We welcome Strategy Report 2021, detailing these requirements and financial needs of each pillar broken down into individual deliverables. We are currently evaluating these and ask the ACT Accelerator to publish regular updates detailing the measures that have been financed as well as those that are still pending financing. We strongly believe that this transparency will motivate existing partners to increase their support and, importantly, new partners to participate. We are currently considering additional contributions and urge all partners, especially other G20 countries, to step up their support for Act A. In addition, we would welcome stronger involvement of the private sector, as it has been mentioned previously as well. As the ACT Accelerator requires another $27 billion in 2021, we are all well aware that we have to work together to close this acute funding need. This will only be possible with broad international support And only with that, we will reach our goal to actually control this pandemic that we all are suffering from. Thank you very much.
Thank you very much, Germany. I understand that the Honorable Minister of Health for Nepal is online, who has a personal engagement and would like to make an intervention. So I'll crave the kind indulgence of our two other speakers who had indicated their willingness to take the floor now, so I can give the floor to him. Honorable Minister, you have the floor, please.
Dear Mr. Chair, Co-Chair, Honorable Ministers, distinguished participants, Nepal would like to share the vision of Access to COVID-19 Tool Accelerator Facilitation Council, which has a unique mission for fast-track the development and equitable deployment of COVID-19 vaccines, therapeutics and diagnostics globally, while strengthening related health systems. In my 1 month experience as a minister of Nepal's Ministry of Health and Population, I have fully realized the importance of an eminent platform like ACTA Council. Thus, my special thanks goes to the World Health Organization and the European Commission for their leadership in co-convening this first meeting. It is an honor for Nepal to be a member of the ACTA Council representative South Asian countries, as a privilege to work with distinguished co-chairs, President of South Africa and Prime Minister of Norway, and other valued members. ACTA is no doubt a global multilateral mechanism to ensure the fair and equitable distribution of vaccine, diagnostic tools, and therapeutic across the world. This has pronounced our commitment towards the agenda of leaving no one behind. Nepal will continue to take part in this process and bring forward issues, challenges, and opportunities to combat the COVID-19 pandemic. In Nepal, the cases and death from COVID-19 has been reduced significantly, and it is in declining trend. The government of Nepal has mobilized whole of the government and whole of the society, which has been instrumental in providing better care, ensuring and adherence the public health measures, and generating the resources. The timely preparation and implementation of co-state rapid action plan has contributed in curbing down COVID-19 in Nepal. We would like to offer our special thanks to Covax facility under ACTA for allocating 2.26 million doses of COVID vaccine for Nepal as the initial tranche. The timely delivery of this allocation would mean a lot to the people and government of Nepal. The government of Nepal has started vaccine inoculation to the frontline workers. We have received 1 million doses support from the government of India. Our standing commitment is there to vaccinate the elderly and vulnerable populations. Nepal has already developed vaccine readiness and development plan and made impressive progress on logistic and supply chain across the country. We appreciate the assistance provided by bilateral agencies, UN, including key technical support partners like WHO. I thank you all and look forward to the deliberations in this meeting for an equitable distribution and commitment to solidarity. Thank you very much. Thank you.
Thank you very much, Honorable Minister, for your intervention. May I now invite the Honorable Assistant Minister from Japan, Honorable Keiichi Ono. You have the floor, please.
Thank you very much, Dr. Tedros, co-chairs, ministers, ambassadors, colleagues, and friends. Thank you very much indeed for holding this very important meeting. We have seen encouraging developments from ACT Accelerator over the past 10 months. Japan reiterates its commitment to Act A. I'm delighted today the vaccine's distribution to 145 countries will be soon starting through Covax facilities. No one is safe until everyone is safe. Vaccine supply is crucial. With the arrival of the vaccines, however, we will enter into the new era. Sir Whitty, thank you very much for your presentation on the revised, refreshed strategy. The refreshed strategy is necessary for this evolving context and for achieving UHC. I'd like to commend the tremendous efforts of Sir Whitty and his team. Now, all the aspects are important, but I would like to stress 3 points. First, in order to scale up our achievements, we need to bring our attention to health systems strengthening. Once the COVID-19 tools are arrived at the port of member countries, essential services and materials should be ready, including cold chains, data systems, public financial management, community engagement, and health workforce. We need to take care of those essential systems. Second, I would also like to reiterate the importance of the effective and efficient use of our investment on the ground. We need to support the actual scene where those tools are delivered so that the country performs and coordinates effectively based on their demands. Coordination among relevant stakeholders, including member states' governments and international organizations on the ground, is crucial. Last but not least, I would like to highlight that upgrading the governance of the ACT Accelerator is necessary, not only to overcome this global pandemic, but also to facilitate overall reform of the global health architecture, so that everyone, anywhere, has access to quality, resilient, and inclusive health systems without facing financial hardship. Thank you very much.
Thank you very much, Honorable Assistant Minister, for your intervention. May I now invite Mr. Colin McCliff, who is the Acting Director for Global Affairs, U.S. Department of Health and Human Services. Mr. McCliff, you have the floor, please.
Thank you very much, dear moderator. Thank you, ministers, DG. It's great to have the opportunity to take the floor for this important meeting. And I want to also thank and appreciate the incredible work and coordination that's gone into the development of this new strategy. As President Biden expressed on his first day in office, the United States will partner with the WHO and the entire UN system to respond to COVID-19, improve global health and health security, and build a better future for all people. Today, as we work together to advance multilateral efforts for COVID-19 vaccine, therapeutics, and diagnostic distribution, equitable access, and research and development, this collective effort is extremely important. As such, the United States is pleased to transition from observer to participant in the ACT Accelerator Facilitation Council and plans to fully participate in these meetings going forward. We want to underscore the commitment of the United States to multilateralism and our common cause to respond to this pandemic and improve global public health. Thank you very much.
Thank you very much, Mr. McCliff. I will now invite Dr. FIFA Rahman, Health Poverty Action UK. You have the floor, please.
Thank you, Chair. There's something missing in this strategy and budget, and that's specific allocations and plans for the health and welfare of people living with long COVID. And while there are still so many unknowns about the long-term prognosis of long COVID and its pathophysiology, but emerging evidence is showing considerable health burden with evidence of organ dysfunction and aberrant immune responses. More than a year into this pandemic, the narrative that COVID-19 leads to binary outcomes of death or survival is not adequate. The Office of National Statistics in the UK has estimated that 1 in 10 individuals have persisting symptoms beyond 12 weeks of infection with SARS-CoV-2. The tools of the ACT Accelerator can act as primary prevention tools, both from death from COVID-19, but also the long-term effects of long COVID. This will stop a huge amount of human suffering, but is also a strong case for investment and cooperation, as long COVID will be a huge burden on health systems and indeed economies. Providing a further strong moral, humanitarian, and economic case for equitably distributing the tools required to combat COVID-19. That the strategy does not account for long COVID is a glaring oversight, which must immediately be remedied. And in line with the theme of the next session, our promise to the world at risk must include promises to people with long COVID. And we as NGOs look forward to working with you on including this. Thank you.
Thank you very much, Dr. Rahman. I have my last speaker, which is India. I should give the floor to India and encourage you to be brief in your intervention so we can move on to the next session. Thank you, India. You have the floor.
Thank you very much. On behalf of the Government of India, I'm Dr. Paul, Niti Aayog, and Dr. Vijay Raghavan. We are making the following quick statement. India is rolling out COVID-19 vaccine programs since 16th January 2021. The current focus is to cover 300 million population of India, comprising those over the age of 50 years, the healthcare and frontline workers, and individuals with comorbidities. In a matter of 23 days, the country has covered more than 6 million beneficiaries. Since 20th January 2021, India has sent as gift 6.27 million doses to 12 countries in South Asia and Middle East. Additional 2.95 million doses will be gifted in February and March 2021 to another 30 countries, including those in Africa, Caribbean, and the Pacific Islands. The Serum Institute of India, the largest vaccine manufacturer, is manufacturing Covishield, and it has contracted to supply 200 million doses of vaccine to Covax. SII is also making contracted supplies to various governments across the world, and exports of 10.5 million doses have already been made in January 2021. Another 25 million doses are likely to be exported in February. The Government of India is coordinating closely with this vaccine manufacturer as well as others to enable them to meet their commitments toward domestic requirements, Covax facility, as well as contracted exports in a balanced, smooth, and sustained manner with due regard to production capacity, output, quality management, and program requirements. India has a robust pipeline of multiple additional vaccines. Other than the two already a part of the rollout, 2 others are in phase 3 trial, and 3 more are in phase 1 and phase 2 clinical stages. Additionally, more than half a dozen other vaccines are in the preclinical stage. As we move forward, it will become practically impossible to conduct phase 3 trials with COVID infection rate as the outcome variable because of the diminishing incidence of COVID-19 infection in India and elsewhere. This situation calls for considering other study endpoints as proxies for efficacy. A different framework for vaccine evaluation needs to be developed urgently. We believe CEPI and WHO are working in this area. An early guidance in this regard will be highly useful to India in particular. Thank you very much.
Thank you very much, India, for your intervention. That ends the intervention from the floor. I shall now give the floor back to Honorable Minister Mkhize. You have the floor, please.
Thank you very much, Jude. I think from the time we have, we won't be able to take any further questions. So thank you so much for that session. Clearly, we all share a sense of agency in rapidly and massively scaling up the vaccinations. It is good to see this being prioritized in the new strategy and budget, but we must remember that vaccines along with will not do the job of ending the pandemic. The world still needs to massively scale up access to diagnostic, my apologies, I didn't realize my video was off. So let me just proceed that the world still needs to massively scale up access to diagnostics and therapeutics, and we urgently need stronger health systems in order to deliver them. I think we all recognize the importance of the X Accelerator's integrated agenda in this respect, and it is pleasing to see the stretch ambition in place for ramping up diagnostics to 900 million for low and lower middle income countries in 2021. It's also great to see the extra focus on increasing global access to oxygen under the therapeutics pillar as a critical part of the clinical care package for COVID-19, along with dexamethasone as the only known life-saving treatment. But scaling up access to vaccines, diagnostics, therapeutics that we already have is only part of the picture. Emerging variants of concern have shown us that we are facing an evolving threat, one that will inevitably need us to create new and optimize tools for the future. For this reason, the X Accelerator ongoing focus on R&D in the strategy and budget is incredibly important. I encourage you all to read this refreshed X Accelerator prioritized strategy and budget carefully, and to provide for feedback to the Council Secretariat within the next few days. It will be finalized and published this Friday, 12th February, and we have no time to waste. It is time to execute this plan for 2021. With that, I'll now move to the next agenda item, which is all about the political choices we make to end this pandemic together. The theme now is our promise to the world is at risk, accelerating fair and equitable access to COVID-19 vaccines. Delegates, the world's largest ever vaccination campaign has begun, but as we know, COVID-19 vaccines have not yet arrived in the vast majority of low and lower middle income countries. This is not just a moral issue, but one that we, even wealthy countries, should be concerned about. The new variants tell us that until everyone is safe, no one will be safe. The objective of this session is for the Council to establish a common understanding of the challenges we're facing and to discuss a way forward for achieving global equitable access to COVID-19 vaccines as fast as possible. We will therefore start with a keynote speech from Dr. Ngozi Okonjo-Iweala, WHO Special Envoy for ACT. Then we will hear from a distinguished panel of speakers before again opening up for a council discussion. Dr. Ngozi, you have the floor.
Thank you. Thank you, Dr. Mkhize, for that introduction. Dr. Tedros, Excellencies, ladies and gentlemen, my fellow envoy, Sir Andrew Whitty. Let me first start by welcoming the USA to the ACT Accelerator, and also express my thanks to the Council co-chairs and members for their dedication to making the ACT Accelerator a success. Ladies and gentlemen, it has been more than a year since the WHO declared COVID-19 a public health emergency of international concern. With more than 104 million confirmed cases and over 2 million deaths, I don't need to tell you how the pandemic has laid waste to our economies and our communities. It continues to wreak havoc all over the world, and it affects us all. We listened to what Minister Mkhize had to say this morning about what is happening in South Africa. And it moves ever closer home as we lose relatives and friends. Just 3 weeks ago, I lost a dear friend and colleague, Professor Ebida Obe, in the midst of exchanging messages with him by email. I didn't hear from him for a couple of days, and I didn't know that in that time he had passed away from COVID. This is vivid for many of us. As the virus mutates, the incredible work that has gone into developing tests, treatments and vaccines is in jeopardy. Left to rage anywhere, the virus is a threat everywhere, potentially developing into even more infectious or virulent strains, as we've heard repeatedly, rendering our current tools possibly ineffective. We cannot delay the rollout of tools around the world. Equitable access to COVID-19 tools is not just a moral imperative, as Dr. Tedros said, it is a strategic and economic one as well. Global solidarity is the fastest, most effective way to defeat the pandemic. Our economies, countries, and communities cannot recover if disparities in global coverage persist. Sorry, excuse me, sorry. I apologize for that interruption. There is hope on the horizon. Over the last 9 months, the ACT Accelerator has supported the fastest, most coordinated and successful global effort in history to develop these tools to fight the disease. Thanks to unparalleled speed and collaboration by academics, scientists, private and public funders, and the pharmaceutical industry, we now have several effective COVID-19 vaccines. As a result, COVID-19 infection could now be prevented everywhere. The ACT Accelerator's Covax vaccines facility is poised for the fast-track distribution of 2+ billion doses of internationally recognized, safe, effective, and quality-assured vaccines across 109 participating countries and economies. And countries are ready. 124 Covax participating countries have already completed readiness assessments to prepare for their health systems for a huge vaccination campaign, including 90% of the lower-income AMC countries. COVAX has also received vaccine request forms from over 95% of advanced market commitment eligible economies. As we speak, COVAX partners are supporting countries to finalize work on difficult national regulatory and legal issues, such as indemnification and liability. Given the contraction in available official development assistance, many more countries will have to bite the bullet and find sustainable ways to finance and co-finance COVID-19 tools, including through multilateral development banks. Early rollout of vaccines is about to start, with a target of at least 20% coverage of the most vulnerable groups in all participating countries by the end of the year. However, there are challenges. A persistent underinvestment in global solutions and increasing bilateral action threaten to limit the success of a coordinated global vaccine rollout to end the pandemic. On the screen, could I have the screen on, please? On the screen, you can see which countries are vaccinating around the world. People in more than 60% of high-income countries are now being vaccinated, while only a handful of people in low-income countries have been vaccinated. If we want to stop this pandemic from spreading and mutating, we need to change the way this map looks as fast as we can. Governments everywhere are under immense pressure to secure doses for all their citizens. Many cannot afford the bilateral deals. Others are still seeking them, and some have secured more doses than their populations require. Solving these problems requires all of us to come together to find solutions. Big political choices need to be made. We know this is not easy, but we don't really have a choice but to make those decisions. Countries, manufacturers, regulators, civil society, and actors in the multilateral system all have a role to play to ensure that vaccines reach people in all countries, prevent infection, and end this pandemic everywhere. I just want to say that this is why we're here today. I look forward to hearing from the panel and hearing from the council about what needs to be done and how we can do it. Time is of the essence, and our global collaboration is crucial if we want to stop this virus from accelerating further. Thank you, ladies and gentlemen.
Thank you very much, Dr. Mkhize. Let's continue to explore the issue of equitable access to vaccines. I'm delighted to introduce our distinguished panel, who can speak from the perspective of country leadership, industrial, and civil society. May I also just request for your indulgence, a slight change in our program due to competing pressures of work. I'd like to first call Mr. Pascal Soriot, who is the Chief Executive Officer of AstraZeneca, to make remarks, and we are aware that he's got pressure, so he will have to leave quickly. Then I'll come back to my colleague, the fellow minister from Indonesia. Please proceed, Mr. Pascal Soriot. Please proceed.
Thank you very much, Minister, and also thank you so much to our co-host, Dr. Tedros and Pierre. So it is really an honor to join this discussion today. From the very start, AstraZeneca has been a key supporter of Covax. We joined the effort back in June last year, and our goals are very much aligned with Covax. As an organization, we are committed to providing broad, timely, and equitable access to the AstraZeneca Oxford vaccine, and we do this at no profit during the pandemic, so we can provide a low-cost vaccine that lots of people can benefit from. What is really compelling about Covax is the ambition to ensure that safe and effective vaccines are available worldwide to protect the most high-risk and highly exposed populations globally. This is crucial to the ability to control the pandemic. Our commitment as a company to supply Covax, together with our collaboration with the Serum Institute of India, who are developing the vaccine together with us, means that over 300 million doses of the vaccine could be made available to 145 countries in the first half of this year, subject to regulatory approval, of course, in the various countries, but we already have approval in 50 countries around the world. Our capacity for the month of February on a global basis is 100 million doses manufacturing across the network, and we hope to get to 200 million doses a month as of April. So as you can see, we are really scaling up rapidly to try and serve as many people as possible. So our supply to Covax means that on average, 3% of people in these countries will receive the vaccine. And I'm really proud to say that 61% of our projected supply for Covax during this period of time is due to go to low and middle income countries. For many of these countries, this vaccine will be the first they receive, and it's one that can be used within existing healthcare conditions. It can be stored in regular fridges, for example, and it's very easy to use. And that should enable critical workers and the most vulnerable populations to be immunized, which really speaks to the importance of this multilateral facility and why the support of industry is so vital. Like Covax, following the science is at the heart of our efforts at AstraZeneca. We are rapidly learning about this virus and, importantly, the variants, including how they may impact vaccine effectiveness. Our vaccine has been shown to be well tolerated and give 100% protection against severe disease, hospitalization, and death from the primary analysis of about 17,000 participants. The vaccine provides 76% efficacy after the first dose, which increases to over 80% when the second dose is given up to 12 weeks later. In recent days, we have also seen positive news on the efficacy of our vaccine against the UK strain, so-called Kent strain, and early data from a small phase 1/2 trial in South Africa against mild disease showed limited efficacy, which of course is a concern. Having said that, the patients in this study were patients with mild disease, and we believe that the vaccine should still protect against severe disease. The efficacy against the disease varies according to the severity of the infection. And we're working with the government to evaluate the vaccine against severe disease caused by this B1351 strain, or so-called South Africa variant. Right now, it is essential that vaccines continue to be administered to as many people as possible. the protection offered by the vaccines far outweighs the risk of vaccine escape from potential new variants. And many companies, including ours, are working actually on new vaccines that will cover these new variants. With this in mind, we look forward to the results of the WHO SAGE policy guidance, which we hope will pave the way for WHO emergency use listing as we advance toward the start of distribution via Covax. Our team and many other teams across the entire industry are all doing our very best to deliver during this challenging period. Vaccines, we know, are saving lives, and it's clear that multiple effective vaccines are needed to defeat the pandemic. And we look forward to being joined by multiple other companies to provide vaccines to Covax. In closing, I would like to thank our Covax partner for their tireless work and their shared dedication to this cause. There is, I believe, light at the end of the tunnel, and I'm confident that the community, society, healthcare system, and the economies will soon be able to build back and thrive once again. Thank you very much.
Thank you very much, Mr. Pascal Soriot, and for your remarks. And I do believe that the collaboration between governments, the manufacturers, the scientists, the researchers will actually help us to solve all the problems that relate to this new variant, and also ensuring us that we get the best out of all the vaccines that we've got. At this point, therefore, let me take the opportunity to introduce my fellow Minister of Health, Honorable Budi Gunadi Sadikin of Indonesia, and would like to give you the floor, Honorable Minister, so you can make your comments. Thank you very much.
Mr. Zweli, thanks a lot for a perfect pronunciation of my name. So, Dr. Tedros, Director General of WHO, Excellency Ministers and Honorable Speakers, ladies and gentlemen. Indonesia is still struggling with the high confirmed case and also fatality rate. Now we are focusing our energy and effort to increase our testing and tracing and also isolation capabilities. And also we are focusing our energy and effort on the vaccination programs. Indonesia is believed that we need to enhance synergy and cooperations among countries, organizations, civil societies, and private sectors, for equitable and timely access of this COVID-19 vaccine. Indonesia has also been a supporter of Covax facility. We are a member of AMC 92 Covax countries, and I also have my fellow foreign ministers sit as a co-chair of Covax AMC Engagement Group. And we have to thank Covax that hopefully by this quarter, we will start receiving the 3% allocations of Covax vaccine. And thanks a lot, Mr. Soriot. It is coming from AstraZeneca. And aside from this participation in Covax facility, Indonesia also have the capacity for vaccine manufacture. And we are actually very open if there is any pharma companies that would like to enhance their global supply facility to use our facility. We believe that we can find any innovative ways, promoting technology transfer, strengthening the local manufacture capacity. And we also a strong believer that we need to encourage countries with big bilateral deals commitment to share the surplus vaccine with Covax facility. And in closing, I personally believe this is not the time for us to do this alone. This is the time for us to do this together. I also personally believe that this is not the time for us to do this inclusively or exclusively, but this is the time for us to do this inclusively. And the last things, this is not the time for us to do individual country programs, but this is the time for us to establish a global movement as a tribute to humanity. Thank you.
Thank you very much. Well said, Minister Sadikin, and thank you very much for a very, very profound statement. Indeed, this now needs us to work together. We need to have an inclusive approach as we deal with this matter. Thank you for your insight. At this point, therefore, I'd like to move on and hand over the floor to Dr. Paul Stoffels, Chief Scientific Officer of Johnson & Johnson. Paul, you are on the floor. Thank you very much.
Thank you, Dr. Mkhize, Dr. Tedros, Mr. Delso, Mr. Dr. Ngozi, and members of the Council, esteemed colleagues. Thank you for the invitation to join the ACT-A Facilitation Council meeting this afternoon. COVID has put to the test decades of scientific research into innovative vaccines and technology, as well as the ability of the global community to work together to make rapid progress against a novel pathogen. The pharmaceutical and biotechnology companies were able to develop and deliver an effective vaccines for COVID-19 under 12 months, breaking all historical records in vaccine R&D. With several COVID-19 vaccines now having received emergency use authorization from the US FDA, conditional marketing authorization in Europe, but also from the WHO and several other regulatory authorities globally, the hope is that the tide of the pandemic will turn. But nevertheless, we'll never fully stop COVID-19 until everyone, everywhere, has access to an effective vaccine. The need to bring COVID-19 vaccines to the world equitably has become even more pressing in recent weeks as we see more infectious strains of the virus emerge in multiple countries and the spread rapidly across the world. The evolution of the virus means that we have to stay vigilant and constantly adjust our scientific approaches, which will require ongoing surveillance, innovation, and investment. And the situation has become starkly clear. We are in a race against this virus, and we are in a race against time to vaccinate the world. Johnson & Johnson worked with partners to develop a vaccine, conducted large-scale global clinical studies in 3 continents in 200 clinical centers, and commenced vaccine production with the goal to make 1 billion vaccines in 2021. And this is a single-dose vaccine, so 1 billion vaccines would mean 1 billion people. During this time, we also rapidly established a global network of new manufacturing partners across 3 continents, and we continue to activate additional manufacturing sites to enable even more and larger volumes. Since day one of our program, we have been committed to bringing an affordable COVID-19 vaccine on a not-for-profit basis for emergency pandemic use, and of course, pending regulatory authorizations, which we are working through at the moment. Johnson & Johnson has also pledged to provide up to 500 million doses of COVID-19 vaccine to lower-income countries. As a strong partner of the Covax facility, in December 2020, we reached an agreement with Gavi in support of Covax to help deliver on this commitment. As with all vaccines, we must make it clear that manufacturing and supply chain process is not plug and play, but both time-consuming and highly complex. It takes time to activate new sites globally for vaccine production and fill and finish procedures that meet safety and quality standards. And once set up, the production process remains meticulous and is subject to stringent quality checks at every stage. And we must stay also focused on what it will take to deploy them and effectively. Vaccines won't reach anyone if regulatory processes are in countries or if the right frameworks are not in place from a legal perspective, and if programs are not grounded on and fully prepared. And manufacturers continue to play their part by allocating significant human and financial resources to the effort, in many cases at their own financial risk, and we are working with governments and many other partners to ensure efficient approval, manufacturing, and deployment of the vaccine. The government leaders globally need to understand these complex challenges so that all of us, manufacturing, governments, and foundations and civil society, are a unified front against the virus. What we are seeing today is that the pandemic is evolving due to global dynamics and emergence of resistant virus, raising the urgency for global coordinated action. Beating COVID-19 will require constant surveillance, continued rapid innovation, including potential boosters development and other new vaccine strategies, and close partnerships between government and vaccine makers. Only through innovative collaboration, fueling new ideas, well-planned implementation of equitable approach, as well as constant vigilance and sense of urgency, will the world beat COVID-19. In closing, I would like to thank the Covax organization for all the collaboration on providing vaccines globally. And we are there to work with you. Thank you.
Thank you very much, Dr. Stoffels, for your very illuminating address. And we must also commend you, your company, for being amongst the continents that you have looked at for your manufacturing value chain. You have considered that some of the work should be done in the African continent, and we hope that more manufacturers will follow that example. Your vaccine is indeed very exciting and give us great hope that people living in low resource settings may be able to receive COVID-19 vaccine. I'll now hand over the floor to Caroline Gomez, one of our Facilitation Council civil society representatives. You're on the floor. Caroline, you're on the floor. Thank you.
Thank you so much, Minister, and thank you to all the participants. All of the amazing work and technological achievements of the last year since the formation of the ACT Accelerator are under threat. They're under threat from the SARS-CoV-2 virus, which blindly seeks out any path to success, changing continuously, relentlessly, remorselessly, until one or more of its changes results in success. Success for the virus is increased danger for the world and our efforts. Success for the virus has rendered our efforts across all the pillars of the ACT Accelerator less effective. Variants have threatened our vaccine successes to the point that South Africa and other countries with the South African variant may not be able to use with maximum effectiveness one of the vaccines developed to control the suffering and death the pandemic is causing in countries. Success for the virus has rendered some of our hard-fought gains in therapeutics ineffective, just as we are beginning to roll them out. And now we have to look to different monoclonal antibodies, more effective therapeutics. Success for the virus threatens our testing regimens and adds new urgency and challenges in the need to track and understand the way in which the virus is mutating and spreading in populations in ways that make it impossible for countries to test, track, trace, and control. Perhaps most dangerously, the success of the virus has brought another virus to the fore in the world. This virus of selfishness, of nationalism, of me-firstism, sees new technologies for vaccines locked in vaults and not made available for manufacture in countries that have huge swaths of the uncontrolled spread and large quantities of the world's underserved and marginalized and vulnerable. The virus of me-firstism sees limited money being spent in a way that is safeguarding all of us against the future. Limited money on the tools needed to get us beyond the acute pandemic period. Limited money on the need to adapt and increase the efficacy of existing tools. Limited money on the need to respond to the unknown long-term impacts of COVID-19 on individuals, health systems, and economies more broadly. Also, the me-firstism virus threatens to derail all our preparations, including economic recovery, for the next pandemic. ACT Accelerator has the power to defeat this me-firstism virus. Indeed, it has demonstrated the power of collaboration in bringing to the world the tools we have now, 11 months later. But to defeat this virus and effectively outrun the SARS-CoV-2 virus, we must steer the ACT towards those ends by ensuring that equity is not only our first principle, but also our lived reality for diagnostic tools, for therapeutics, for vaccines. That all procurement contracts are fully transparent and open to thorough scrutiny. That all contracts include stipulations around open licensing and deep technology transfer. And that the voices of the lower middle income countries and lower income countries find full expression and equal space in our work and at our decision-making spaces. In this effort, it is not enough to donate our leftovers of vaccine or funds to those who cannot afford. We must ensure that ACT Accelerator commits to engage on the basis of a common understanding that unless we defeat the virus everywhere, we defeat the virus nowhere. We must engage in a way that internalizes and addresses the fact that without equity, without continuous, relentless, remorseless, changing, strengthening, and including everyone, the virus of me-firstism will overwhelm our efforts to end the COVID pandemic. The terrifying prospect that SARS-CoV-2 will beat us, defeat us, is real. Thank you.
Thank you very much, Caroline. Well said. And as we defeat this virus everywhere, we will defeat it nowhere. Thank you for your intervention. It has never been more important to engage communities as it is right now in this campaign to end COVID-19. If we move on now, we will now hear from Mr. Giles Mwesh, excuse my pronunciation, the Chief Economist of the AXA Group. Please, Mr. Giles, you are on the floor. Thank you very much.
Thanks a lot, Minister, and thanks a lot for giving me the opportunity to address such a distinguished audience on such an important topic. Opening access to vaccines to all is, of course, primarily a humanitarian duty. But here, as a representative of a global investment manager, I would like to focus on why it is also in the economic interest of the developed countries. The economic and financial damage triggered by the COVID pandemic knows no border. Even the countries which managed to keep the propagation of the virus in check without resorting to wide-ranging national lockdowns were hit by the collapse in world demand. Symmetrically, a full and lasting recovery will need to be global. If we allow the pandemic to survive in some regions, every country, even those with the most advanced healthcare systems and thorough vaccination programs, will remain at risk. In the absence of global vaccination programs, the probability of seeing a stream of resistant variants will rise, at significant risk of spreading to even the best protected economies, which could result in mobility restrictions becoming a sort of permanent state. Significant sectors in all economies, international travel, with ramifications for the aerospace industry, for instance, and tourism-related activities, would remain hampered. Beyond the impact on the real economy, such developments could have toxic effects on financial stability, global financial stability. Financial markets have rebounded in a spectacular fashion since the turmoil of March 2020. This was to a large extent the product of extraordinary support from central banks everywhere in the world, but also because investors always considered the pandemic as a temporary shock. The emergence of vaccines in the second half of last year gave financial markets more reasons to be optimistic about the outlook. Because we collectively failed to organize widespread access to vaccines across the globe, markets start doubting that some sort of pandemic resolution can be in reach, the market backlash could be significant. And the last thing the world economy needs at this very delicate juncture, with fiscal and monetary policy entirely mobilized to mitigate the real impact of the crisis, is more financial stress, which would weigh on central banks. What can we do concretely? AXA Investment Managers for several years now has been committed to promoting an effective access to medicine and health for all, as key factors to supporting economic growth and stability. This has been a focus of our engagement activities with pharmaceutical companies and governments, with more than 60 of them engaged in 2020 alone. AXA Investment Managers joined in May the group of funders of the Access to Medicine Foundation, becoming the first investor funder. We were convinced at that point already that collective action would be absolutely essential to address the pandemic, facilitate access to vaccines, and then prepare for the future. And the foundation was an excellent channel for this. Today, as we need to ensure an efficient access to vaccines in all geographies, AXA-IM is very glad to be part of a group of 97 signatories gathered by the Access to Medicine Foundation, representing more than $11 trillion in assets under management, which are committed together to play our part by first working with the Access to Medicine Foundation and engage with the healthcare companies we are invested in. That's the continuation of our engagement strategy. Second, recommending governments to explore the feasibility of innovative finance mechanisms like social and vaccine bonds, building on the capital market response to ESG-related bonds in 2020. The current plan is to release the statement during the week of February the 22nd, when the Access to Medicine Foundation will have its investor launch event with Goldman Sachs, and the G20 meeting will take place. Investors' commitment is essential, and we also call governments to act, funding Act A and exploring these innovative finance mechanisms. The time to act is now. I thank you for your attention.
Well, thank you very much. Thank you very much, Mr. Giles, and thank you all. That brings us to the end of our panel discussion. Clearly, achieving equitable rollout of vaccines globally requires the commitment and hard work of a range of actors working in unison. I'll now hand back over to Jude to moderate the council discussion, and I'm looking forward to hearing your perspectives on what we can all be doing to accelerate the fair and equitable access to COVID-19 vaccine. At this point, I'd like to hand over to Jude. Please take over, Jude.
Thank you very much, Honorable Minister Mkhize. We have a few countries that had already indicated that they would like to make an intervention. With your permission, I should like to call on them and then obviously take the list of countries that have raised their hands in the Zoom function. If you permit me, then I would invite the Secretary of State for International Cooperation for Spain, Honorable Angeles Moreno. You have the floor, please.
Yes, good morning, and thank you for organizing this meeting. Spain continues to support with no reservations Act A, and to support the fact that all inhabitants of the planet should have access to COVID-19 tools, whatever their citizenship or any other variant. It's important to fight the fragmentation of countries amongst themselves, but also the various pillars of Act A. Until now, it's been necessary to individually finance each pillar of Act A, and we have had calls to finance each of the goals, and it's necessary to offer a narrative and to ensure that there is a supply to all of Act A without just looking at individual pillars, so that we can ensure we cover the funding gap of $27.2 million. Between the various pillars, it's important to look at scientific criteria and to look at the funding difference between the various pillars. It's impossible to combine the financing of Act A with other measures such as sharing doses. We are part of the European Union program, and we are following the vaccination program in solidarity, giving priority to the multilateral channels such as Covax and following criteria for equity. It's important to have innovative financing instruments such as IFIM, which was so successful in financing Gavi. It can be an example for the obtention of significant funds with long-term commitments from donors and significant participation by financial partners. So we commit to a multilateral coordinated response to ensure that we meet the joint challenge of COVID and that we do so efficiently. Thank you.
Thank you. Thank you very much, Honorable Minister. We have a pre-recorded video for the Minister of Europe and Foreign Affairs, Honorable Jean-Yves Le Drian from France. I shall ask that the video be played, after which we will take up other interventions. Thank you.
Director General, ladies and gentlemen, ministers, ladies and gentlemen, members of the ACTA Council. The pandemic has reminded us that in a world of exchanges and interdependence like our one, the health of some depends on the health of others. As long as the virus continues to remain rife, no country will be truly safe, and it is not possible to think about returning to a normal life anywhere. Only a global, coordinated and solidarity-based response will help us to end the pandemic. Based on solidarity, because in the face of such a challenge on a global scale, solidarity is not just a requirement of humanity, it's also a question of efficacy. It's a requirement that is something that requires us to take action, and this is the thrust of the ACT initiative that France has contributed to since spring last year, focusing on guaranteeing universal and equal access to COVID health tools. The first success of Act A can be seen through collective mobilization, which sends out a clear and strong signal jointly within the WHO. International organizations, member states, and private associations are working towards a clear goal which seemed unachievable a few months ago. We have been able to raise awareness and raise hopes in the world. Together, we are able to live up to this new multilateralism of action and to achieve results that we sorely need today during this crisis and beyond. Jointly, we must ensure that we can raise awareness about Covax and ACTA, because this initiative has not received the degree of publicity it deserves. In a context where the virus is mutating and where production capacities have been saturated, our responsibility as members of the Council is to stay on this track and to ensure that we can rise to the challenges that await us. We must redouble our efforts operationally speaking by accompanying the growing strength of Covax. We must start to roll out the vaccines to low-income countries. Generally speaking, we are collectively committed to allowing all healthcare products to become a global good. The Charter for Fair Access to COVID health products, which we will be adopting today, thanks to the investment of Dr. Tedros and the President Macron, is a clear commitment, a concrete commitment that will allow us to make headway in the operational implementation of the principles that unite us. We need to ensure that public financing is geared towards research. It's about sharing research and transfer of technology. We need to ensure that vaccines are available at a fair and transparent price. We need to ensure that healthcare systems are strengthened further. This is a decisive commitment that we are undertaking today, and it must guide us in the months and years to come. Whatever the challenges that we will face, it must be our compass, and it must remain at the forefront of all of our action. You can count on France to promote this charter amongst our partners and to act so that all of the health tools to tackle COVID-19 become a global public good. I know we can count on your support. Thank you.
Thank you very much, Honourable Minister. I'm made to understand that the Deputy Director General for Global Affairs in the French Ministry would like to add on to what the Honourable Minister just said. Mr. Pierre, you have the floor. Thank you.
Yes, thank you very much. I will be very short. As our minister has just made his speech, just to tell you that on the charter, France acts as a facilitator in this process, because we are convinced that beyond financing, we need to be united around principles. And this charter is about really principles, what we want to do regarding multilateral action, about sharing of data and knowledge, about transfer of technologies, etc. So I would like really to tell all of you that we had this process together. There was a silence procedure which ended last Thursday. And of course, our intention is to make this charter a collective offer, of course. So it is not a charter for our council, but for each individual state who would like to be part of it. And of course, if some countries do not feel comfortable to have the name of your country on this charter, please tell us this afternoon, and we will, of course, withdraw the name of your country. And there will be a possibility to join later on this week once you have achieved your consultation within your ministerial framework. So this was the only procedural point I wanted to make, and thank you very much for all your inputs on this charter. But I think we really took on board as much as possible, and I hope this is consensual now. Thank you very much.
Thank you very much, Mr. Cyril Pierre, for that brief intervention. I shall now invite the Minister of Health of the Russian Federation, who has sent a pre-recorded video, after which we will invite the Minister from Norway. You have the floor, please.
COVID-19 pandemic has become a major trial for many countries of the world and the international community, despite the efforts taken at international level in terms of mutual assistance to tackle the infection. The number of patients continues to rise. To reverse this negative trend, it is vital to establish cooperation on an equal footing on a whole array of key issues of healthcare at a bilateral and at a multilateral level. An example of such cooperation is the ACT-A initiative. Another key issue is the formation of a portfolio of effective and safe vaccines, with the aim of ensuring that the whole population of the planet enjoys reliable protection. In the Russian Federation, we have registered and we are using 2 Russian vaccines against COVID-19. We see that the efficacy of these vaccines has been confirmed, and these vaccines provide long-term immunity. The Russian Federation has started to roll out its vaccination program as of the 11th of December 2020. At this stage, we can talk about the vaccination of over 1 million Russians. Following the principles of the initiative of ACT-A and taking into account the outcome declaration of the G20 leaders, the Russian Federation stands ready to actively cooperate with countries and international associations in order to enhance the access of Russian vaccines, medicines, through multilateral cooperation. Given the current vaccine shortages, we call upon the countries and vaccine producers to actively localize their productions, and we would like to ask ACT-A to facilitate this process in any way. Thank you.
Thank you very much, Russian Federation. And I have the honor to invite the Minister for International Development, Norway, Dag Ulstein, after which I shall invite the Director General for International Cooperation, Italy, to take the floor. Norway, you have the floor, please.
Thank you so much again, moderator. I think we all agree that we have a whole lot to thank science, the vaccine industry, the pharmaceutical companies for when we see this the extreme achievement in such a short time. But at the same time, the same companies have a tremendous responsibility now, and we are very pleased to see the leadership of the 2 CEOs represented today, but we need more to follow suit in this. So if we are to increase global production capacity, we cannot operate in business as usual mode. And I would like to introduce for you some 4 pragmatic principles for the pharmaceutical company action in 2021. And the first principle that is file for registration rapidly, widely, and based on the most rigorous standards. And vaccines can only be made widely available in countries when filed for registration and authorized by national health authorities supported by an emergency use listing from the World Health Organization. And these processes are important to secure one global quality standard for all people. The second principle is price product equitably. We call on pharma companies to implement pricing strategies that take countries' different levels of ability to pay into account. Companies should agree cost plus prices with the Covax facility for the 92 advanced market commitment eligible countries. And the third principle is expand production and supply capacity. We call on pharma companies to implement all possible strategies to increase manufacturing capacity. Technology transfer and voluntary licensing play key roles when in-house or contract manufacturing cannot meet external demands. And the fourth principle, disclose more information about efforts and progress against these principles. More transparency from the industry would enable us in governments and global health organizations to respond to company efforts and coordinate the global financing and distribution system better. So I hope that we can continue this important and constructive dialogue with the industry and within this group to explore ways of which we can solve the most urgent bottlenecks hindering equitable access. Thank you.
Thank you very much, Honorable Minister. May I now invite the Director General for International Cooperation, Ambassador Giorgio Maripodi. You have the floor, please.
Thank you. I wish to thank you for giving me this opportunity, and I am glad I can add my voice in welcoming the fact that the rate of immunization has overtaken that of new infections from COVID-19. Still, most vaccinations are taking place in a relatively small number of countries, as we heard today from main speakers. It's clear that the pace of the recovery depends on our capacity to ensure universal and equitable distribution of vaccines, but also of therapeutics and diagnostics. We should leave no one behind, according to the principle of no one is safe until everyone is safe. Building on this principle of solidarity and of coordinated multilateral response to COVID-19, I wish to outline three main concepts. Firstly, the ACT accelerator, together with the Covax facility, still is, in the Italian view, the best tool to address the current pandemic, and our efforts, therefore, must focus on its success on the ground. Within the Italian G20 presidency, Italy stands ready to mobilize the political support needed for the ACT accelerator and the Covax facility to deliver concretely on the commitments undertaken within the G20 almost a year ago, when both the ACT-A and the Covax facility were launched. A milestone in this process will certainly be the Global Health Summit due to take place in Rome on the 21st of May. We are working together with the European Commission to frame the discussion and define the deliverables that should be part of a set of principles on pandemic preparedness and on strengthening the multilateral global health architecture. Secondly, Italy intends to contribute to the discussion on closing the financing gap of the ACT accelerator. During the recent high-level meeting of the Ministers of Finance of the ACT accelerator on the 29th of January, it became clear that ODA is simply not enough to bridge the financing gap of the accelerator, even if we account for recent significant incoming contributions. During the latest Deputy Finance Ministers meeting of the G20, which took place on January 26, we launched a high-level independent panel on financing the global commons for pandemic preparedness and response. In our view, this panel will help find a way to tap into the financial resources needed for a resilient path forward to build back better. Finally, we shall involve all stakeholders in the successful implementation of the accelerator. We should raise the bar higher, also for the private sector. We must scale up research and development to take into account the new virus variants, increase production also through cross-collaborations, share the research data with the WHO to speed up the process of emergency authorization. In a few words, we must simply think creatively and in a solidarity spirit to explore all paths to accelerate production and supply of diagnostics, therapeutics, and vaccines. We shall not idly wait for this storm brought by the COVID-19 pandemic to pass. The multilateral system, which we created almost a year ago through the accelerator and Covax, is still the best instrument in our hands, and we must all work untiringly for for it to deliver fully on its mission. Thank you, sir.
Thank you very much, Ambassador Marapodi. I shall now invite the permanent representative and ambassador of Brazil to the UN, Ambassador Maria Nazareth, and then we'll invite Dr. Vijay from the UK, who had earlier indicated he wanted to speak, but I missed him. My apologies. Dr. Ambassador Nazareth, you have the floor, please.
Thank you, dear Jude, for giving me the floor. I want to start by acknowledging the important role of the Facilitation Council to support the objectives of the ACT Accelerator, particularly to promote the development of medical products and their equitable distribution to fight the pandemic everywhere. Let me also reaffirm our solidarity to those who have lost their loved ones and to the health workers everywhere. At the multilateral level, Brazil is engaged in all major efforts to support countries and to promote the equitable access to COVID-19 products and technology, and we want to remain an engaged partner. I want also to acknowledge the approval of the ACT-A Charter on Equitable Access and thank and congratulate France for this initiative. An important example of that is the cooperation between the Brazilian government and AstraZeneca to develop and produce vaccines. Colleagues and excellencies, throughout our dialogue today, we addressed one of the primary objectives of this meeting, which is to discuss and provide advice to accelerate fair and equitable access to COVID-19 vaccines. At the very beginning of our discussion today, I think very important points were made by the DG and by the co-chairs of the Facilitation Council when they spoke about equitable distribution of vaccines by reminding us of the moral imperative, the health dimension, and the economic dimension of equitable and fair distribution of vaccines. Other points, or the good points, were made also by other presenters, including those of the private sector. We spoke about financing mechanisms and regulatory environments. As much as these points are very important, I want to echo the Brazilian voice to these points, but I also want to add other issues to this discussion that are very relevant to the COVID-19 fight. We must make our common, the equitable distribution of vaccines our common objective, because this is the single exit strategy to the pandemic. If only a few get vaccines at the expense of many, we will not defeat the pandemic. Worse, with the new variants of the virus that only adds layers of complexity and challenges to the fight against coronavirus, this pandemic will keep on taking lives and making livelihoods and a daily struggle for people, for governments, and for politicians. So to those countries who control the majority of the production of vaccines, we have a message, and we would like this Facilitation Council to think and to discuss those points that I'm going to make now, because this is the time to expand vaccine production everywhere. This is the time to talk about local production. This is the time to talk about existing mechanisms, such as licensing, to improve local production, to improve availability of vaccines. This is the time to improve global health and to improve the coalition building that is the spirit of this Facilitation Council. So let's move beyond principles and let's talk about how to make vaccines available to everyone, everywhere, right now. Thank you.
Thank you very much, Ambassador Azevedo. May I now invite Dr. Vijay. You have the floor, to be followed by Saudi Arabia.
Great. Thank you all very much. It's a pleasure to be here. The work of ACT Accelerator is absolutely crucial, but all of you know that as well as I do. And since we last met, there's been enormous progress. And I think we should acknowledge that. Huge scientific progress developing vaccines, 2 billion doses for Covax. And it is incredibly great that Covax will start imminently distributing vaccines to countries for their vulnerable populations. We completely agree from the UK that global access is the only way to end the pandemic, as many of you have said. And I think the emergence of new COVID-19 variants underscores the essential need for a truly global response. The ACT-A excellent strategy correctly sets out the scale of that challenge. The real challenge of these new variants, which require new and amended vaccines, means we're not facing a one-off where a single set of vaccines will help cure this, but it's going to be a global science challenge for the foreseeable future, involving identification through genomics, involving new and variant vaccines, involving all the therapeutics and diagnostics. So we're in it for the long run. So from those three pillars, science, money, and systems, I think all that quite clearly requires money. We are very proud to support the ACT Accelerator partners. The UK has given funding of £330 million for CEPI, FIND, and the Therapeutics Accelerator. We must continue innovation. That is absolutely crucial. We must support the WHO, and the UK is very proud to have given £340 million as a core voluntary contribution to strengthen that vital organization. And of course, Covax, which is the absolute heart. We've given £548 million to Covax AMC and mobilized further to £1 billion of funding. That is important because the investment case for Covax for vaccines is absolutely incredibly strong. We have seen the economic case. It is so obvious what the virus is costing each of us, all countries, every day. So we need global action. From the UK, we welcome the new and prioritized strategy and the budget for 2021, and we must continue to optimize international and domestic resources. For the UK, as G7 presidency, we are going to work with fellow G7 nations to drive an ambitious health agenda that exactly reflects these principles many of you have set out of equitable and affordable access. And these are principles obviously at the heart of the ACT Accelerator. We'll work with our Italian colleagues in the G20 presidency, country partners across the world, the ACT Accelerator, multilateral development banks, civil society, and industry. And this is going to be a big part of our G7 presidency. And what we do now has to be the foundation for a longer term response. So my third point is going to be more systemic change. Boris Johnson, the UK Prime Minister, has set out ideas for pandemic preparedness, and we intend to take those forward, working with all partners. The WHO Executive Board took some important decisions, and we hope the World Health Assembly is going to continue and build on those. I strongly agree with the Italian Minister about the importance of the Global Health Summit, and we have a lot of hope riding on that. And with my Brazilian colleague who just spoke about the need for more and strengthened productions. In the long run, this is with us for a long way. We also need to consider what systemic strengthening is needed, what more broad international agreements are actually needed to prevent not just the difficulties of this pandemic, but future ones. So the challenge is really large against us, and we will be working with all of you and take great pleasure from that over the course of the next year, and I think well beyond. Thank you very much indeed.
Thank you very much, UK. May I now invite Saudi Arabia to be followed by Singapore. Saudi Arabia, you have the floor, please.
Thank you very much. Thank you very much. Excellencies, Chair and Co-Chair and colleagues, good morning, good afternoon, and good evening. Excellencies, Saudi Arabia steadfast to the principles of the ACT-A Accelerator as a rapid deployment and rapid development and equitable deployment of various pandemic tools, leaving no one behind. We strongly believe that a successful ACT Accelerator is the most critical global interventions in our fight against COVID-19. Excellencies, we need to think differently about concepts of equitability. COVID affected continents, countries, ethnic groups very differently. We can't explain that by different national responses or variation in the virus itself. Therefore, we'll call for an actual real-life measurement and forecasting of the toll of the pandemic on different societies. This will help us to map, stage, and prioritize vaccine allocation rather than just following reported cases count and mortalities. Every country and every human being should have access to safe and effective vaccines, diagnostics, and therapeutics. We strongly oppose vaccine nationalism and bilateral over-purchasing practices that are the most prominent hurdles to equity. Excellencies, Saudi Arabia call for more support and advocacy to the diagnostic and therapeutic pillar of ACT Accelerator. They are equally important, and we need them more than ever in the face of the variant of concern. Finally, we share concern that some of the financial commitments made to the ACT Accelerator are not fully materializing and call for immediate interventions by all of us to boost the funding of various ACT A pillars. Thank you.
Thank you very much, Saudi Arabia. May I now invite Singapore to be followed by the World Economic Forum. Singapore, you have the floor, please. The Office of the Prime Minister, you have the floor, please.
Good day, and thank you very much, Mr. Moderator. I make this statement on behalf of the Caribbean community, CARICOM. As the world grapples with the challenge of controlling the COVID-19 pandemic, the Caribbean community is deeply concerned at the current prospect of inequitable access to vaccines to address the pandemic, especially for frontline workers and vulnerable populations. The reality is that small states will find it difficult to compete in the marketplace to ensure equitable access for vaccines. Given the transmissibility of the virus, all countries are vulnerable and should work together. The Caribbean community therefore calls for a global summit in the context of the World Health Organization's ACTA Facility and Council to discuss equitable access and distribution of the COVID-19 vaccine. In the inextricable link economically, socially, and by virtue of travel with our neighbors and the wider international community, makes it imperative for CARICOM member states to be afforded access to vaccines in a matter of urgent priority. This action will be mutually beneficial in breaking the transmission of the virus. Notwithstanding that appeal, the community will explore all available options to access vaccines in order to protect its population from the ravages of the pandemic. Thank you.
Thank you very much. That brings us to the last intervention, but certainly not the least. We would invite Honorable Arnaud Bernard from the World Economic Forum to take the floor. You have the floor, please.
Thank you very much, dear co-chairs of the ACT Accelerator and Excellencies. On behalf of the chairman of the World Economic Forum, Professor Klaus Schwab, I would like to, with this short intervention, reiterate our support to ACTA and its latest integrated prioritized strategy. The accelerator is the only global mechanism with principles of universal access and equity at its core. And this is where we strongly stand behind the charter initially presented at the Paris Peace Forum and now in a final stage. We're also very encouraged with the renewed focus on R&D led by CEPI, FIND, and other partners. We want to stand behind those efforts as the International Organization for Public-Private Collaboration. So we decided to intensify, and further operationalize our support to the ACTA Accelerator. This is like Albert Bourla, the CEO of Pfizer, was pointing out during the Davos Agenda Week we hosted a couple of weeks ago. We learned in the past year how powerful science and multilateral collaboration can be when they operate in tandem. We also want to recognize that of the trillions in economic output at stake in the next years, we need to recognize that the private sector organizations will bear a large part of that if they do not meaningfully contribute to the response. So this is where we want to double down on the successes of last year and why we decided, and we announced that during the Davos Agenda Week, the launch of our public-private high-level task force for pandemic preparedness and response. This is a task force that is largely so inspired by the many contribution offers from our partners. I would like to also thank Mr. Bola from Pfizer and I saw Richard in the audience today from CEPI, obviously. They have agreed to be the first two co-chairs of the task force, and we are now in the process to recruit more foreign partners, diagnostics companies, vaccines manufacturers, investors, supply chain operators, policymakers, and others. Our commitment is to focus the work of the task force in areas that can really be helpful to ACT-A. First focus areas being genomic surveillance and vaccine development and manufacturing acceleration in support of the CEPI 2.0 strategy. So we welcome your interest and we remain available to provide details. Thank you very much.
Thank you very much, Arnaud. Chair, that concludes the interventions from the floor. I shall now revert to you. Thank you.
Thank you very much, Jude. Thank you all for your contributions. Some of our challenges are at the national level, but which much of what we have spoken about affects or will affect all of us. This is why we need a global solution. We need to find ways to enable emergency expansion of vaccine production. This will need a new level of collaboration between industry and governments to rapidly expand and sustain production capacity globally. We'll need to see novel technology transfer and licensing arrangement as soon as possible. Of course, as my country knows only too well, we need the global R&D efforts to continue and even accelerate in order to ensure our vaccines can stay ahead of the variants. We need immediate action on the part of the powerful G7 and G20 leaders to come together and unlock the potential of the Covax facility by initiating the sharing of their scarce vaccine resources and by ensuring the full financing of the ACT Accelerator and Covax facility. To lead us through the agenda item on ACT Accelerator financing, it is now my pleasure to hand over to my distinguished co-chair, Minister Ulstein. Please take over. Thank you very much.
Thank you again, Minister Mkhize. So now we turn to the important issue of financing the ACT Accelerator. Real progress has been made on this front since we last met. A small working group of the Council, including Norway, South Africa, Italy, the UK, Indonesia, Germany, Mexico, and the European Commission, have been meeting regularly to develop a financing framework for the ACT Accelerator. Also, as many of you will know, on Friday, the 29th of January, finance ministers of Norway, South Africa co-hosted a high-level meeting between the Council, G20, and OECD finance ministers. This meeting explored various ways to mobilize the financial resources needed to bring the pandemic under control and the great return on investment that this would bring. And we heard some of that already in this meeting also. I will now hand the floor to my colleague Halvor Widberg, Director for International Economic Affairs in the Norwegian Ministry of Finance, to share some of the outcomes of the Ministries of Finance meeting. So Halvor Widberg, the floor is yours.
Thank you, Chair. Finance Minister Sanner sends his greetings. Unfortunately, he did not have the opportunity to participate himself. Instead, I will give you a report from the Finance Ministers meeting on his behalf. The main aim of the meeting was to enhance awareness and engagement among finance ministries. On the agenda was how to collectively resolve the global economic crisis caused by the COVID-19 pandemic and to explore how to mobilize the needed resources more effectively. Presentations by high-level representatives of the WHO, the IMF, the Commission, European Commission, and also Lord Jim O'Neill and ACT-A partners gave a good overview of status and challenges regarding the pandemic, the link between the disease and the global economy, and the needs in order to end the pandemic. The discussion showed a broad agreement along the following lines. 1, defeating the virus is necessary for a durable economic recovery. 2, Cooperation on supply and distribution of medical treatment and vaccine is pivotal, not only for people's health, but also for putting an end to the global economic crisis. And 3, investing in global control of COVID-19 through equitable rollouts of these technologies is probably the best economic stimulus that can be given to our own economies. There was a very clear support for working together to mobilize the resources needed to accelerate vaccine rollouts to all corners of the world. An Act A funding gap of $27 billion to be filled within 2021 was presented. The US representative referred to the US decision of allocating $4 billion to Covax that will reduce this number to around 23 billion. This is a large number still compared to today's global budgets for official development assistance. But as pointed out at the meeting, it is small compared to the economic return of beating the global pandemic. To use another reference, if all G20 and OECD countries donate $0.5 per mil of their GDP, these funding needs are met. Many of the participants indicated that they will look into the possibility of making more funds available for Act A, and that they understand the importance of moving fast. The multiple ways of contribute were explained. Also, the possible use of a front-loading financial mechanism in line with or within the IFIM framework was covered. To expand such a mechanism or establish a new, we need early indications that new countries would consider giving legally binding commitments for the coming years, which can be transformed into available resources today via the bond market. At the meeting, only one country distinctly indicated that this was of interest. The chair concluded that this possibility would be elaborated further. Many participants call for multilateral cooperation and for guidance and leadership from the G20, G7, and other important players. And they seem to agree that this will be crucial for the way forward. The chair concluded that, as a next step, G20 and OECD governments might expect an invitation to a more formal resource mobilization and pledging meeting. But he underlined that this is in the hands of the Act A partnership. Thank you.
Thank you very much, Halvor. Indeed, investing in global control of COVID-19 through equitable rollout of these technologies is the best economic stimulus we all can give our own economies. To take us through the Act A financing framework, I will now hand the floor to my colleague Jon Arne Røttingen, Ambassador for Global Health in the Ministry of Foreign Affairs. So, Jon Arne, you now have the floor.
Thank you, Minister Ulstein. And I have some slides to share, so please put them up. I would like to then speak on behalf of the Finance Working Group of the Facilitation Council, and I appreciate all the hard work both by the hub and the membership, the country membership of that group. Next slide, please. Just a reminder to all of us that the Act A is really an accelerator. It's the additional efforts that were needed in addition to the sort of normal capacities of organizations. And I must say, really impressed by all the hard work of the principals and of the implementing partners. We wanted to deliver speed and equity, both for the development of and delivery of both tools we didn't have when we started, and also tools that we need more of. So both scarce and available, widely available essential tools. Next slide. You have heard and presented the revised plan and strategy and budget of the Act A. So what we have done now, compared to what you saw in the previous Facilitation Council meeting, is an update on the aggregate budget envelope for the Act A partnership. And as the last time, we have divided it up along the value chain, combined now the budgets of all the pillars, but of course we have much more detailed information here. And as you see, the main need is really related now to ensuring equity through global procurement and rollout of these technologies. Very well reflected and on by the panelists and by the interventions from countries in the previous session. Next slide, please. And we did, and this is also a reminder, did assess many different financial sources and financing mechanisms as a part of our work. But we needed to boil down actually just to a few suitable mechanisms. It will be the support from World Bank and other multilateral development banks to self-finance and domestic finance for paying part of these costs, but then in majority to rely on direct grants from governments to collective contributions, as well as using, as we just heard from Halvor Widerberg, the potential of IFIN as a social bond, but also potentially developing a new social bond for the purpose of Act A, depending on demand from countries. And that could then provide the necessary front loading, making sure that we can have cash now and pay into the future. Next slide, please. We have then looked at the total gap, remaining gap of 27.2 billion and assessed the different sources. As many speakers have said today, and we also heard very consistently in the Ministers of Finance meeting, we see that existing official development aid can only be able to contribute a small proportion of the total needs. We understand that the loans and the financial resources available from the multilateral development banks is important, but a lot of that will need to go to implementation and delivery in countries and will not cover the collective financial needs of the Act A partnership. So it will be additional to the Act A partnership, and it can also provide additional coverage of, for instance, vaccines, but also other tools. So this leaves us in very many ways to a bill of 19.1 billion additional dollars needed from high-income countries and upper middle-income countries. If we include the more than $5 billion, almost $6 billion contributed by the same countries, it means that in total, these countries would need to contribute collectively into the common pot of Act A, or the many common pots through the different partnerships. So we have a total cost of $25 billion, where we have 19 billion to go. And we have then used a burden sharing approach. Next slide, please. And this is still work in development. It was presented conceptually in the previous meeting. It's been developed by the financing working group and also presented and discussed at the Minister of Finance meeting. I would like to take you through it very on a high level. In many ways, we see this then as countries as those who need to responsibly contribute together. The income of countries is the GDP. So the starting point is GDP. Then we adjust the GDP based on the level of openness of the economy. So the level that individual country economy is dependent on import and export and globalization of the world economy. And finally, we introduce the progressivity so that richer countries need to pay more, a higher proportion of their income than less rich countries. And finally, we need to adjust for some potentially lack of full commitment to have a fully budgeted Act A. And then finally, we need to approach countries and have discussions with countries based on also qualitative and subjective assessment in such a dialogue. And that would be then a clear ask for contributions from individual countries. For illustration purposes, next slide, please. We have developed sort of an approach where we then categorize countries in different ranges of contributions. We should say that this is for illustration. It's not fully developed. But what I want to illustrate here is this is a large and broad group of countries extending the traditional donors and extending also the membership of Act A. So my final message is that this is a joint responsibility. We really need to have a framework for splitting the bill responsibly. And this is not based on how much we eat, to put it in the jargon of a meal, but based on means and what we can contribute to the common meal. Not based on an old model of donations from a few but a new model of collective contribution from a much larger group of countries. This is solidarity in action, and we really hope that now countries hopefully will increase their contributions in the weeks and months to come. They will actually link this to a framework of fair financial contributions from everyone. Thank you.
Thank you so much, Your Honor, for this work, and a huge thank you to the working group. We are all in this together, and the approach you have outlined recognizes that we need to share the cost of ending the pandemic. I would now like to open the floor for Council commitments and statements of the topic of Act A financing, and ask that Jude once again facilitates this interaction. So Jude, you have the floor again.
Thank you very much, Honorable Minister Ulstein. We do have a pre-recorded video from the Honorable Minister for Foreign Affairs of Japan. We would like to play that, and then we will take up any request for the floor.
昨年5月の ACT アクセラレーターの発足以来、関係機関の尽力によりワクチンの開発普及に向けた取り組みが進んでいることを歓迎します。新型コロナを克服するためには国際的な連携、とりわけ多国間の枠組みを通じた協力が重要です。日本は ACT アクセラレーターの共同提案国となり、途上国を含むすべての国に対してワクチン、治療薬などへの公平なアクセスを確保するため、Covax ファシリティにいち早く参加し、資金拠出してきました。また、任意の知的財産ライセンスの推進などでも積極的に貢献しています。ACT アクセレーターの喫緊の課題は、必要とされる資金ニーズを満たすことです。日本は Covax ファシリティの事前買取制度への拠出を増額し、合計で2億ドルを拠出することを表明します。さらにグローバルファンドを通じた保健システムの強化、ユニットエイドを通じた治療薬の普及にも積極的に取り組んでいきます。新型コロナ対応においては、人間の安全保障の理念、誰の健康も取り残さないとの観点から、ユニバーサルヘルスカバレッジを実現することが重要です。また、将来の危機に備えた保健システムの強化や、栄養、水衛生等感染症に強い環境整備が不可欠です。日本は今後とも国際社会と手を携えながら新型コロナ対策に全力で取り組んでいく考えです。
Thank you very much, Honorable Minister for Foreign Affairs. I do not have any further request for the floor, so I shall pass the floor back to you, Honorable Minister Ulstein. Thank you.
Thank you again, Jude, and thank you all for your ongoing commitment and statements of the support through this meeting to the ACT Accelerator, and I hope that we will be able to turn these commitments into concrete financing for the Accelerator as soon as possible. I would now like to end this item, but before moving on to the closing session, I would like just to ask Dr. Bruce Aylord, the head of the ACT Accelerator Hub, to reflect on what he has heard here today. So please, Bruce, the floor is yours.
Thank you very much, Minister Ulstein, and to both yourself and Minister Mkhize for taking us through today's proceedings. In the interest of time, just perhaps three key takeaways. I think we first heard a strong endorsement for the vision that the principals who are all here today and listening from all of the core co-convening agencies have put together in the strategic plan and budget for 2021. It sounds like that plan is right, the priorities are right, and the budget is necessary. And that's widely understood and accepted. So appreciated as a first takeaway, as well as that need for a shift of, I think, the second takeaway from the planning, the strategizing, the designing to the actual doing and implementing and financing of this work. And I thought that there were some fantastic statements to that effect to move forward on the equitable access and expanding the production capacity. I think we had some very helpful advice on how we may move from both the perspectives of industry, the pharma industry, from CSOs, and also from the private sector, crucially, as well as our government and bilateral partners. But that theme of moving past the principles, I think, as the ambassador from Brazil put it, was heard repeatedly throughout. Because clearly we're at a very, very different point than when the Council first met. At that very first meeting of the Council, we had a completely different situation. Today, we can prevent the disease. We can actually detect very rapidly anywhere the disease with the rapid diagnostics that the diagnostics pillar has identified now and gotten fantastic prices for. And we can also save lives for those with severe disease as a result of the work that the therapeutics pillar has done. So we fundamentally changed the ability to change how this pandemic affects us, affects our economies and societies, but we can't do that without scaling the production, as we've been talking about, and the equitable access. And in that regard, just to recognize and thank Japan, of course, for the announcement of the additional support. But as importantly, I would like to thank the UK and Italy, who committed their presidencies of the G7 and the G20, respectively, to take forward the Act A agenda to ensure that the challenges now that hold it back from realizing its full potential are actually overcome. And to that, certainly tremendously grateful. So with that, Ministers, Honourable Minister, thank you so much for the opportunity to share a few reflections, but clearly we're headed the right direction. We're not headed there fast enough, and we need the support of the groups that this Council represents to get there.
Thank you so much, Bruce, and let me also take this opportunity to thank you and the Hub for providing excellent Secretariat support to the Council and to the co-chairs. So, distinguished delegates, we are coming toward the end of the Council meeting. So thank you all for a rich exchange and for your continued support for Accelerator as part of the Facilitation Council. Minister Mkhize and I will be issuing an outcome statement of this meeting later today. Our Council Secretariat will share this with you all. So, Minister Mkhize, may I ask you to close the meeting for us today?
Thank you very much, Minister Ulstein, and thank you all, distinguished colleagues. We have no time to waste. The pandemic will not cease without our strong political and multilateral action and collaboration. Let's get behind the ACT Accelerator to make it a success. We have another 2 days left to feed back on the new 2021 strategy and budget for the ACT Accelerator. Please, let's do so. Then please, let's do everything you can to engage and add your political force to our global solution. Bring the ACT Accelerator to the fore in your regional fora, through economic fora, bilaterally and multilaterally. Let's keep working together to find solutions to the challenges we face and end the acute phase of this pandemic and all the hardship it causes this year in 2021. With those words, I'd like to thank you all, and this meeting is adjourned. Thank you very much.
Okay, thank you.